Hi guys, welcome back to the channel. If you're new here, my name is Dr. Nosa and I'm a medical doctor in the UK. In today's video, we're going to be discussing eczema, also known as atopic dermatitis, a very common skin condition I see and treat almost every day at work. I know through my patients that eczema can cause a lot of distress and affect your self-confidence, especially when symptoms are quite bad. I'm hoping that you can learn one or two things from this video, but please remember to always seek your own doctor's advice because this video is just for educational purposes. The focus of this video will be to tell you how to treat eczema, how eczema differs on white versus black skin. I will also be sharing the ideal skincare routine for people with eczema or eczema-prone skin, as well as sharing some medications and lifestyle changes that should hopefully help as well. Eczema, also known as atopic dermatitis, is a common skin disorder that tends to run in families. We don't know what causes eczema, but what we do know is that in eczema, the skin barrier is defective. It's not working as well as it should be, and that causes that really dry skin that you get with eczema. Ideally, in skin not affected by eczema, the skin barrier should protect the skin from losing a lot of water and therefore not becoming dry. But not only that, the skin barrier should also protect the skin from bacteria, irritants, which can cause infection or inflammation of the skin. However, in eczema, the skin barrier, which I mentioned is defective, doesn't function properly and allows too much water to leave the skin. And this is what causes that dry, itchy, cracked, sore skin that you get with eczema. Not only that, because the skin barrier is defective as well, people that have eczema are more likely to have infections of the skin or irritation of the skin. In lighter skin tones, the inflammation associated with eczema appears red. However, it's much harder to see red in darker skin tones. In darker skin tones, eczema appears to be more of a darker brown, purple, or even grey color. In general, in darker skin tones, anything that causes irritation or inflammation of the skin is likely going to cause hyperpigmentation of the skin. Eczema can also cause lighter patches of skin in comparison to the overall skin tone, known as hypopigmentation. This is also more common in darker skin tones and tends to happen when eczema is resolving. When it comes to eczema, or most medical conditions to be honest, we like to complement medications with lifestyle changes because that is what's really effective than using one alone. The first lifestyle change is to avoid triggers of your eczema. Now, you may not know the trigger of your eczema, but you can try and do some detective work to try and find out what those triggers may be. Contacting your doctor as well to help you narrow down those triggers would also be helpful. Common triggers to watch out for include soap, detergent, fragrance products, cold weather, and food, amongst many others. Eggs, wheat, soy, and peanuts account for 75% of food-induced atopic eczema. So you want to watch out for those things in your diet. What I'd really recommend is keeping a food diary. So basically over 2 to 4 weeks, write down what you're eating, and then if your eczema flares up, take notes and look back at your diary of what you've eaten lately. If you notice that, whenever you eat this thing, your eczema flares up, eliminate that item or food from your diet and then see if your eczema gets better. Second lifestyle change to make is to manage your stress. I know it can be very difficult to manage stresses in your life, but you really want to try as best as you can because stress has definitely been proven to trigger eczema. Practice some self-care, mindfulness, and just try and relax. Keeping your nails short is also advisable in eczema because at least if you do itch, because I know it's very, very difficult not to itch, you're causing less damage to the skin because your nails are short. In terms of skincare products, believe me when I tell you the most important product you can take from this video to help manage eczema, so preventing eczema flare-ups and inflammation, is a good emollient. An emollient is basically a moisturizer. Emollients generally come in 3 forms: an ointment, cream, or a lotion. Ointments have the highest oil content, followed by creams, and then lotions. Lotions have the highest water content and the thinnest. Theoretically, ointments, because they have the highest oil content, should be the best moisturizer for eczema. However, they're not very well tolerated by people. People complain that they feel greasy, uncomfortable, they stain clothes, and because of that, people don't end up using them regularly. You're better off picking something that you find comfortable, and I find cream is a good middle ground. The presence of some water in it, when water evaporates from the skin, it cools the skin, and that is a better feeling than having an ointment on the skin. But not just that, in comparison to lotions, because they have a higher oil content than lotions, they're a better moisturizer for the skin as well. In terms of medication, if your skin is inflamed, you would most likely need steroid ointment or cream to help manage your eczema. Steroids would help with the itching, swelling and redness associated with the eczema flare-up. The strength of the steroid you get prescribed will depend on the severity of the eczema that you have. For mild cases of eczema, we tend to use mildly potent steroids like hydrocortisone 1%. This can actually be gotten over the counter in the UK. Also, if you have eczema on your face, because the skin on the face is the thinnest compared to the whole body, we also try not to use anything stronger than hydrocortisone 1% on the face. For moderate or severe cases of eczema, we tend to use stronger steroids like clobetasone butyrate, also known as Umovate, or betamethasone valerate, also known as betnovate. Steroids will often be prescribed for use twice a day, and it's usually not prescribed for longer than 2 weeks, because at that point, hopefully your eczema should have resolved. And at that point as well, if we use it for longer, we might notice some side effects, but usually shorter than 2 weeks should not cause any serious side effects at all. For the itching, especially if it's worse during the day, you can try an antihistamine like cetirizine, also known as Pyretes, or fexofenadine, and these can be gotten over the counter in the UK. The reason why I mentioned these two as options to be used during the day is because they're non-drowsy. If your itching is actually affecting you sleeping at night, then you want to try chloramphenemine, also known as Piriton, and that's a drowsy antihistamine. So not only will it help you with itching, but it also helps you sleep better as well. All the products that I'll be mentioning will be linked in the description box below, so feel free to click on it and check them out. Number 1, use a soap substitute for your skin like E45 bath oil or E45 cream wash. Avoid using any soaps or shower gels on the skin because these can dry out the skin. I know that, with soap substitutes, some people don't like the fact that they don't foam when you apply them, but trust me, they're just as good at cleaning the body as those products that foam. My personal preference when it comes to either a bath or a shower for eczema is taking a bath, especially with the E45 bath oil, but you don't have to use that bath oil. You can use any other oil or ointment that you want, but with E45 bath oil, you basically pour one capful into your bath water and then take your bath. And basically the presence of this oil in your water should help water stay trapped in the skin, so your skin is less likely to dry out. For showers, you can use the E45 bath oil, you can use the E45 cream wash, but make sure you're using a soft sponge and you're not scrubbing or rubbing the skin. Try and massage the product into your skin and then rinse your body. Whether you choose to take a bath or a shower does not really matter. What matters more is that you use lukewarm water, so not too hot or too cold, and that you spend no longer than 10 minutes, because doing any of these things will more likely dry out your skin. After the bath or shower, pat your skin dry. When you pat the skin dry, you're basically making sure that the water molecules from your bath or shower remain at the top layer of your skin. You want your skin to remain damp for the next step. Now apply your emollient or your moisturizer ASAP. The sooner you apply it after your bath or shower, the better it's going to work. Because when your skin is damp after you've been patting, when you apply that emollient over your skin, it's trapping that water in the skin, and therefore your skin is less likely to be dry. When using your emollient, or moisturizing rather, you want to apply it using downward strokes, basically following the directions of the hairs on your skin. You don't want to rub because that can irritate the skin as well. The emollient I use and I strongly recommend is the E45 cream and or the E45 itch relief cream. E45 cream is an excellent cream for anyone with eczema or dry skin. E45 contains paraffin, which is an occlusive. So an occlusive is a type of emollient that basically sits on top of the skin and stops water escaping from the skin. So water gets trapped in the skin, and really that's what you want in eczema, because eczema is basically dry skin, and water's getting trapped in the skin means your skin is not going to be as dry. E45 itch relief cream is highly recommended if you're experiencing a lot of itching with your eczema. It contains urea, which is a hydrating agent, so very good at hydrating the skin, and also macrogols, which is very, very good to help soothe the skin and also help with itching as well, hence the name E45 itch relief cream. Whichever emollient you do decide to go for, so it doesn't have to be E45 cream, that's just my preference, you should get one with a pump dispenser. And the reason being is because the presence of a pump dispenser means you're less likely to have bacterial contamination of your moisturizer. If you get one of those ones that comes like in the tub, every time you dip your hands in the tub to take the cream, you're introducing bacteria to that cream. And because with eczema, your skin is already prone to infection, you want to try and reduce the chances of you introducing bacteria to your skin as much as possible. Just as an add-on to what emollient you should use and what I recommend, if your eczema is quite severe, then you might want to consider using petroleum jelly, also known as Vaseline. And that's because honestly, Vaseline is actually the best moisturizer theoretically. It has good oil content, it's going to act as a good occlusive to the skin, trap water in the skin, prevent water from leaving the skin. It's basically really good at that. The reason, like I said before, that I generally don't use Vaseline every day unless it's severe is because it's quite thick, it can be greasy, feel uncomfortable, stain clothes, so that's why I kind of go for the middle ground cream. If you need to use a steroid as part of your skincare routine for eczema, so let's say you have a flare-up, then you want to use your steroid at least 30 minutes after applying your emollient. And this is to avoid you spreading the steroids to places that don't need it, and also avoid diluting the effect of the steroid as well. Now, you should aim to moisturize at least 4 times a day, minimum twice a day. And this is even when the eczema clears. You know you're using roughly enough when you're using about 500 grams of cream every week. That's when it's really effective, because naturally as you go through the day, your moisturizer is going to wear off, so you want to keep reapplying it as much as possible. If your skin stings after trying any of these emollients, then you want to stop that product immediately and try another one. You may have to try a few different emollients to find the best one for you. If none of the measures I've mentioned works for your eczema, you would need to see a dermatologist for more aggressive treatment options like phototherapy, tacrolimus cream, cyclosporin medication, that sort of thing, which you can only really access from a dermatologist most times. Hope you found this video helpful. If you just want to say hi or you have any comments, then please leave them down below. Otherwise, I'll see you in my next video. Bye!